Today we are going to talk about cellulitis. This is a common short case we found in surgery. So when you get a cellulitis patient in surgery short cases, you might think it's easy, but it appears easy. But you have to know all the basics. You can't miss the basics in this presentation. Okay. You can consider yourself lucky if you know all the points. You can easily pass this case. So for short cases, we have to have an order because due to the stress we can forget what we have to examine. Okay, this is the order I followed in my short cases in cellulitis. First, you have to look for the affected area. The second one is the regional lymphadenopathy. Third one is the local complications. And the fourth, systemic signs of inflammation. And fifth is the etiology. When you have an order for the short case, you won't forget anything in the middle. Okay. For the affected area. So for the affected area, in most cases, you usually get cellulitis in lower limbs. But cellulitis in upper limbs can be also given. But when you get the patient with cellulitis, as example we say lower limb, we have to tell up to what extent the cellulitis is spreading. Okay. Then and up to what level, and we have to tell whether the level is distinct or not. Okay. Then at the side we have to look for the cardinal signs of local inflammation. For warmth, then you have to feel the normal limb first, and then feel the cellulitis limb, and you have to compare this and tell whether there is increased warmth in the affected limb, and you have to look for the redness. As I talked to you previously, in redness you have to carefully look and tell whether the redness mark is distinct or indistinct. Whether the mark is very distinct, it couldn't be cellulitis. It might be erysipelas. Okay. Then you have to elicit the tenderness. In short cases, the patient might be in pain, so you don't get touch patient, and you can ask the examiner, or can ask from the patient, is he in pain? Okay, and you can slightly touch the patient and elicit the tenderness. For edema, you have to check the edema pitting or non-pitting, because our differential can change according to the type of the edema. Okay. When we look for the when we complete that local examination, we have to go for regional lymphadenopathy. So we have to examine the regional inguinal lymph nodes. Okay. For third part is the local complications. So we have to see for the blisters, necrosis of the skin of the limb. Okay. And the fourth, the systemic signs of inflammation. We have to check whether the patient is febrile. So you can touch the patient and say he is febrile to touch, or you can check whether the bedside and have a look and say whether there are fever charts or they are marked. Okay. And you have to check the patient's pulse rate and whether she or he is tachycardic or not. Then at the end, you have done the local and systemic examination basics for cellulitis, and you have to find a etiology. Okay. If there is a source of infection like wound, you have to look for the as we take example as a lower limb, you have to look for any wounds. You have to keep looking carefully, look the interstitial spaces, because there can be minor wounds. Okay. And whether the patient is a chronic lymphedema patient. If she or she is chronic lymphedema, edema is not pitting, and there is a like darkening, chronic pigmentation is the lower limbs. Okay. And whether he or she is immunodeficiency, we can ask the patient whether he is having diabetes mellitus or chronic diseases. For the presentation, You usually get 1 or 2 minutes to present, and you have to present all the findings. So I think it's better if you start from the patient's general appearance. Like you can say, it's a middle-aged man, he's ill-looking, and we can tell the febrile part here, whether he's febrile or not, whether he is tachycardic. Then we can go for local examination. We can tell the affected limb, then up to which level the cellulitis had spread, and the signs of inflammation are present here. And we have to tell the regional lymphadenopathy. Then we have to tell the local complications, and if you found etiology, it's better you can tell that this is the etiology I found, and you can end the case. So what are the differential diagnoses in cellulitis patient? As I told you previously, there is erysipelas, DVT, deep vein thrombosis, dermatitis, superficial thrombophlebitis. You have to have a basic idea how do you differentiate and what is your main diagnosis. So you can tell 1 or 2 differential diagnoses. In short case, you might can go to only one diagnosis, so you can tell the differential diagnosis. So this is part I think you should all know, because it's usually asked in the exam. Okay, how you what is the differential between cellulitis, erysipelas, and necrotizing fasciitis? In cellulitis, there is inflammation of skin and subcutaneous connective tissue. As I told you previously, in cellulitis there is no demarcation in the redness. Okay. The erysipelas is the infection of superficial layers of skin, dermis. So there is a sharp demarcation in redness in erysipelas. So the necrotizing fasciitis is necrosis of subcutaneous tissue, usually including the deep fascia. So in necrotizing fasciitis, you can see the necrosis, blisters, like that. So these are basic steps of management. Can memorize it by remain. You have to rest the limb, elevate the limb, mobilize, and the antibiotics, and you have to give the immunization for tetanus and the proper nutrition. For that's the basic simplest thing you should know when you're doing for a cellulitis short case. Okay. That's all.